An AVM, or an arteriovenous malformation, is a tangle of blood vessels within the brain. Normally, blood is taken to the brain by arteries, and once it gets to the brain, it spreads out through small networks called capillaries, which provide the blood to the brain. It then pulls back together into veins, which take the blood back to the heart. Arteries are thick, as they have to withstand strong blood pressure that comes directly from the heart. Veins, on the other hand, are very thin-walled because they see very low blood pressure after the blood traverses through the capillaries. In an AVM, that capillary bed has been replaced, and there's a direct connection between the arteries and the veins by some abnormal blood vessels. These blood vessels are relatively thin-walled, as are the veins. They are seeing the high blood pressure coming directly from the arteries, and therefore there's a high risk of bleeding or rupture because these thin-walled, irregular blood vessels are seeing the high blood pressure. AVMs can present one of two ways. We either find them when they are unruptured, which means they haven't bled yet, or after they have ruptured, which means that they've bled. Depending on how they present, we tend to treat them in different ways. An unruptured AVM, we have time to take care of it. Therefore, Gamma Knife is a reasonable option because we can wait the up to 2 years that it takes for the Gamma Knife to take place. In a ruptured AVM, we tend to treat these much more quickly to prevent further rupture, and therefore we tend to treat those with either surgery or embolization or a combination of both.